Great. So before we start, or as we start, I always like to take a mindful moment. Um, the topic of suicide is heavy. I think many of us in this room today work on the topic of suicide all the time. And so you're well aware of the kinds of ways that it can be triggering to talk about, et cetera. And one of the things I just love about living in Oregon is all the rivers. And I think we can have different relationships to a river. So I pulled out three different quotes that I just wanted to read to you. And then I thought everyone could just take a moment and close their eyes and picture themselves near a river or creek that they love. So the first quote: I would love to live like a river flows, carried by the surprise of its own unfolding. And a river cuts through rock, not because of its power, but because of its persistence. And I understand that everything is connected, that all roads meet, and that all rivers flow into the same sea. So take a moment to just picture yourself by a river. It could be a babbling brook, it could be a roaring river. See if you can just hear that water going by. Take a slow, deep breath in and a breath out. Deep breath in, deep breath out. Imagine your worries flowing away, just the river's taking them out to the sea, and the sea can handle it. You're here just to learn, to connect with other people who care about the same things you do. And you're enough for today. Okay, open your eyes. How are folks doing? Next slide, please. I think most of you here are very familiar with the Alliance, but I always like just to remind folks about who we are. We're the statewide advisory to the Oregon Health Authority, and we are focused around youth suicide prevention, intervention, and postvention. We have members appointed by OHA, and there's about 55 appointed members, and then another 100 or so of you who are really actively engaged with our work. Next slide. One of the key roles the Alliance plays is to try and connect the field, because people doing things in Lynn County may not know what's happening over in Malheur County. And so we have these coalition webinars, and then we also have been able to provide grants through the Oregon Health Authority to coalitions around the state. And this picture here is a picture. Every blue county has a coalition, suicide prevention coalition, and the ones that have a gold star actually received a grant. And we will be hearing from one of the grantees today. Also want to let you know that we have reopened applications for the coalition grants. So if you have a local coalition or regional coalition that is doing suicide prevention work, take a look at the application for the suicide prevention grants. They are up to $20,000, and we will be accepting applications on a rotating basis. The next one that we're accepting is on September 15th. After that, October 15th, and then in November. And Jen just very efficiently put the link up to the coalition grants in the chat. So I'm going to just pause here to see if anyone has questions about the coalition grants before we move on. Okay. Next slide. So I would say this legislative session was really a mixed bag. We were very pleased and surprised that part of the deal at the end of the legislative session was that the governor and the Democrats worked with the Republicans to come up with an agreement to get a vote through for the telecom fee to support 988 and mobile crisis response services. This is really important because basically 988 is a completely new kind of service, and the fact that it's tied up with also having an effective mobile crisis response means that we need to be creative about how it gets funded. Oregon is joining just a few other states in the country that have now passed telecom fees, and believe me, other states all over the country are looking for this because it's such an important service, and it needs to have a sustaining kind of funding source in the same way that 911 does. There was tremendous efforts by NAMI and Lines for Life and AOCMHP and a number of other partners on that one. We also are happy that the House Bill 2646 passed. It requires all schools to administer the Healthy Teen Survey. The reason we cared about that from the suicide prevention lens was that currently we don't have really good data from all of the schools in the state about young people's mental health, et cetera. This will give us statewide data that can inform our work and help us to have more targeted and thoughtful kinds of interventions. Another important bill that passed was House Bill 2002. This the Alliance came in to advocate for this because it was connected to gender affirming care. And we know that there's lots of evidence that gender affirming care is really important for the mental health of trans folks, and that it is an important suicide prevention tactic. And so that the fact that that passed is I think quite amazing, and we will see how that unfolds in the next year. The other thing I'd really want to appreciate about the legislative session is I feel like as an alliance, we got to work with partners in a new way. For example, worked closely with the Oregon Education Association on advocating for the House Bill 2646, but also worked with them around some legislation that was introduced that we were really concerned about, that would have required many more kind of bureaucratic steps around suicide assessment and prevention in schools, and didn't really take into context the fact that Addie's Act exists. So Oregon Education Association, Basic Rights Oregon, NAMI, we've continued our strong partnership with Lines for Life and are always looking for other policy partners. Most recently have begun to work a little bit with the Oregon Public Health Association as well, which I think could be a really promising partnership for us in terms of advocating for policy moving forward. Next slide. There were some real disappointments this session, and it's hard to know what would have happened this session if there had not been a walkout, which meant that for about 6 weeks nobody was in session, nothing could move, it all got stuck. So as an end result, we ended up with no new funding allocated for suicide prevention from state general funds. And I know many of you here have been involved with working on the Adult Suicide Intervention Prevention Plan. It's really worrisome because it means that we don't have a sustained state source of funding for that work, and that work is really essential. We need to move it forward. So I know we'll be coming back to the legislature in the next long session to talk more about that. The Alliance also did not get our legislation through. It stalled at Ways and Means. This was legislation we had introduced to require healthcare providers to take suicide prevention, continuing medical education. And finally, there was some really interesting and innovative legislation around firearm safe storage that did not get through either. There is some talk now of legislation being introduced for the short session that will take up some of this work around firearm safe storage. And if that happens, the Alliance will be part of working on that group. to do that. I know there are folks in this room who actually may be more involved with that than I am. Is there anything anyone would like to add in about this legislative session? Comments that you have about it? Okay. So that was really kind of just a very brief synopsis, but it's kind of where we are. And I think that legislators are coming back after taking a well-deserved break, and we will probably really be back working up on getting ready for the short session starting in September.
Somebody has a hand raised. Annette Gordon put their hand up.
Yes, Gordon.
Yeah, I'm a little confused. I want to understand, is suicide prevention getting this at least the same funding as we had last year, or are we actually getting less? I know
Oh,
we're getting less than we asked for.
Gordon, thank you that's a really important question. So we are continuing to have, there's $6 million for youth suicide intervention prevention that is allocated through biennium. We will continue to have that. So that hasn't changed. We just didn't increase funding to suicide prevention at all, other than the telecom fee, which is very specifically identified for 988 and MRSS.
Thank you.
Any other questions or comments? Things you want to add in? Okay, well, with that, I want to pass the torch on to Abby Warren from Mid-Valley Suicide Prevention Coalition and hear a little bit about what she's doing. And I know, Abby, it's not just you and a whole lot of other people, right?
Absolutely. Yeah, that's one of my my things I was thinking about here. I'm so excited to be here today. Thanks so much. Jen, are you able to run my slides for me, or should I just queue them up on my end? I'm totally cool.
I have them up.
You're so awesome. Thank you so much. Well, like Annette mentioned, first of all, just thanks for having me. Thanks for letting me come and talk a little bit today. I'm Abby Warren again from the Mid-Valley Suicide Prevention Coalition, and that's a collaborative coalition between Marion and Polk counties. So I represent only a fraction of our efforts. I'm lucky to be part of the leadership, but that is absolutely not the whole picture. So I definitely feel like I'm a piece of the puzzle, but the puzzle is huge, and there's folks like Laura, that happens to be on my screen right under me, who's a super active member of our coalition, as are many other people. Erin, who you'll hear from a little bit later, has been super instrumental in our work over the last year or so. So lots of thank yous I could give, but I know I have limited time. So I'll just say I need, oh, go ahead.
Abby, I'm hearing quite an echo. Are others hearing an echo? Yeah, it looks like others are having audio trouble. Let's see.
Okay, no problem. Let me see if I can maybe join through my headphones really quick to see if we can cut down on that echo. Sorry about that, y'all. Okay, I'm gonna jump off real quick and jump back on my phone to be able to see if that'll help my quality. So sorry, I'll be right back.
I wish we were all in the same room so we could be just having little side conversations with each other.
And Abby's back.
Looks like she's
All right, can you hear me any better?
a bit, yes.
Okay. Sorry about this, y'all. I'm in between meetings, so I'm kind of probably not in the most ideal spot. I apologize. Okay. Let me see. All right. Is that any better?
Yes, much better.
Perfect. Perfect. Hey, this is all about flexibility, right? This is
It absolutely is.
how things go. So let's go ahead and go to the next slide then. And please just continue to let me know if you need me to slow down or you can't hear anything like that. I'm happy to accommodate. So first, I just want to start out with a brief history of the coalition. So our coalition started in 2015, and it was primarily started out of just identifying a need. One of the real instigators of the coalition development, his name was Doug Googe, and he was just absolutely instrumental in spotting a need. He supervised our school-based mental health program in Polk County, and he said, man, I'm just seeing this huge increase in need, and I just feel like there's this gap in coordination. There's tons of folks doing absolutely incredible work, but I feel like we're just kind of disconnected. So how can we kind of develop this hub, and who better to do it than us, right? And so Doug said, let's start a coalition in Polk County and just see how things go and bring partners together. I'm already seeing love for Doug in the chat, which doesn't surprise me because he's a really hard human not to love. He is so great. And so he was really instrumental, along with a bunch of other partners that I'm sure I'm just neglecting to shout out as well. But he's the one that really comes to mind when I think about it. And he, alongside other really incredible community partners, came together and developed the beginning of the coalition. And ever since 2015, we've expanded to really include our Marion County partners. And now it is absolutely a collaborative between our Marion and Polk County partners. And it was so neat that it really all was born out of just seeing a need and saying, I'd love to see this become a little bit more coordinated and really highlight some of the incredible work that's happening across the community. So that spirit, I think, really still is woven into the fabric of what we continue to do today. So that's just a little bit of brief history. And on the next slide, we'll jump into a little bit of what the current structure looks like. So this is just a really broad brush look at what our current structure looks like. So like I said, in late 2018, and then over the next couple of years, Marion and Polk County worked on what does this collaborative effort look like together. And so at this point, now fast forward a number of years later, this is kind of the structure that we've landed on, and that's been working for us so far. So we have our coalition members, which is really intentionally open and broad. So that can include community members, folks that are providing different mental health related services, prevention services, folks that work inside of schools, folks that might be involved in all kinds of our, various community spaces that might be working in or learning about or sharing about suicide prevention and maybe even intervention and maybe even some adjacent work as well. So it's a pretty broad group, and we've had a number of different partners, and we're really working on continuing to identify what are those gaps, who are we missing around the table, and how can we continue to be really representative of the various communities that make up Marion and Polk County. We also have coalition coordinators. So that would include myself and Kelly Martin, who is unfortunately off of work today. So she wasn't able to join, but she is absolutely instrumental in a ton of the things that we get to do. So we work very closely together. So both Kelly and myself are employed by our respective counties, and our work with the coalition is really woven in to our other job duties. And so oftentimes when we've been on the coalition grantee meetings or even just talking with other folks that are working on coalitions, a common thing we hear is, man, FTE is hard, or having people to do this work is really hard, or how do you make this happen on top of other things? And so we can totally relate to that sometimes that coordination piece can be challenging. And we've really gotten to a place where our leadership has recognized the importance of this role. And so they've woven it into our job duties that also might include other pieces. But Kelly and I really cover day-to-day tasks, doing some of the clerical pieces, making sure we're moving things forward and doing all the fun things like meeting agendas and making sure things are on people's calendars, and just continuing to sort of push the efforts that we're identifying as a group. And then we have our coalition steering committee, and they really help us identify the big picture And this is an intentionally rather small group of stakeholders across our county that really, again, help us look at our gaps, our opportunities, and look at how we are progressing on some of the identified goals that we've created as a unit to say, what are we working towards? And are we accomplishing those goals that we've set out to accomplish? Because we know it's not always easy, and sometimes there's course correction and sometimes there's different pieces in there, but this system seems to be working really well for us. And that wasn't the original structure, but we've come to really find this to be a good, effective place for us. Our coalition, our whole coalition meets on a quarterly basis. The coordinators were meeting a couple times a week together. And then our steering committee is meeting on a quarterly basis. So that's how we're kind of set up at this point. And we'll move into the next slide where we kind of talk about what's the current coalition mission, and then we'll talk about the work that we're doing too. So the current mission that we've landed on, again, and this was a big collaborative effort between our steering committee members and even the whole coalition, and it went through a couple of iterations to get to where it's at today. But the current mission is to empower individuals to save lives by promoting mental health, creating an open space for community connection, and making suicide an approachable topic across the lifespan. So that's sort of the guidance that helps us kind of identify what it is that we're working on and help sort of move our work in a direction. And I think it's really neat to see how that's sort of taken shape. And I think on the next slide, we'll sort of see what that looks like in practice and how some of these principles we see them work in real life. So these are some of the tools and methods that we're currently using, and these pictures make me smile because they're really fun and we do a lot of really exciting work. I know that can sound really odd sometimes, because I think initially when folks think about suicide prevention, sometimes that can bring some heavy feelings to the forefront, and that is absolutely valid and makes a ton of sense. And I think we try to really take a strengths-based approach and really offer hope and really try to instill hope when we're out in the community and when we're doing all the things that we do. And I think that shines through when you see some of the photos we have. So a key tenet for us is outreach. We are constantly working to be a part of the community as much as we can. We are super, super thankful for leadership that really supports that outreach and community-based effort there. We also offer a lot of training and help to promote other training outside of coalition sponsored training that's happening in the community. So again, our goal goes back to really being the hub for how can we get folks connected to what they need around suicide prevention across both communities. We also do a lot of community engagement. So if you see in our bottom right corner, you see a bunch of teenage folks in a school building that are all wearing our Life is Better With You Here logo. It's just a positive message on a t-shirt. Kelly has done some incredible pop-ups across high schools. We've done pop-ups in coffee shops. We really just want folks to know who we are, to see our faces, and to be able to interact with our hopeful messages that we bring. We also really like to work with some video-based content. We worked with a couple of high schools in the past to develop some videos based on student ideas that really honor what the students would want for suicide prevention videos, again, with the lens of strength-based safe messaging, and having those be developed into campaigns. So on our website, you can find all of the videos. You can also find campaign materials that accompany those videos. And those have been really popular and really well received. And that's something we're also super happy to talk through with folks that might be interested in bringing that to their community and just talk about what that's looked like and how those have come to be. And the videos are really cool. If you do happen to go look at them, all of the actors, quote, I'm doing quote marks, I can't actually do it because I'm holding my phone, but the actors in the videos are all actual students and staff from the schools, and their message is absolutely born from their voice. And those types of initiatives have just been so neat, and I think really have just carried us through a lot of our programming and efforts. We like to also, go ahead.
Abby, where can people find that video?
Yeah, absolutely. As soon as I'm done, I'll pop our website link right into the chat for everybody, and I'll make sure it's directed right to our video library. Love to share those.
I can put it in for you, Abby.
Hey, thank you, Laura. See, this is what I mean. It is absolutely a community effort. Thanks, Laura. I appreciate it. And again, please use those if that's something that you or a community member would like to use. All of our campaign materials are totally modifiable. So we have some resource cards where you can modify the resources to include the most local resources or the most relevant resource numbers or information on those. We also have posters that are totally fillable. So that's our goal too, is not only sustainable content and stuff for us, but we also really want to make sure that we're being mindful of how we can share this stuff with all of our communities. So please use and share if it feels relevant. And then the last piece is just the restart or the refresh or the rethink. I think as a group, we're not afraid to kind of start over or start from scratch or just rethink things. Again, we've had a number of different iterations of what this group has looked like, what tools we use, what tools we don't use anymore, or what tools we modified to make work. So I think that's just one thing I've seen in my couple of years of having the opportunity to be involved with the coalition is just a real openness to flexibility, and things change often and funding will change and other things change. So just the opportunity to be in the restart and just be able to work from there. So you'll see, again, I didn't really highlight some of these photos. There's a photo of Laura and Kelly in the bottom middle there at the Board of Commissioners proclamation for Mental Health Awareness Month last May. We also have a Happy Dance initiative that happened in Falls City this May, which was just a community block party highlighting mental health and other social resources in the Falls City, Polk County area. So much fun. We also had some Signs of Hope campaigns happen this last May. And then our little stress ball friends, we're always getting new swag and stuff that we can share with the community. So just lots of great stuff happening there. And then on the last slide, I just love to highlight some of the things that we have coming up. So what does some of this new stuff look like? So some things we're going to be working on is sort of a rebrand. You'll see our new logo. I've popped in a couple of times. This is the black and gray scale version, but the full color version is kind of a green. So we're working on a new brand and really including that and incorporating that into all of our things. We really want, again, not only our name, but who we are to kind of resonate in our communities as much as we can, sharing that out, making that something that community members inside of the suicide prevention world and outside of the suicide prevention world are familiar with and recognize. We're also working with a tech company to help us update our social media and website presence. So our website's going to go through a little bit of an overhaul. So if you get to visit it today, that's great. And it might look different next time you visit it because we're just doing a little bit of a refresh, paring things down, making it super, super accessible and getting onto a platform where having really well done interpretation into various languages will make things a lot easier. So that's something that we're really working to prioritize too. We're also going to be working on some community education, and that's going to include hosting some sessions, but then also creating some training materials, purchasing some training materials, having some spaces available for folks to learn more and to access some evidence-based or research-supported training. It's a really important piece for us as well. We're also going to work with a group to help us create some culturally relevant materials. We've found that it's sometimes really challenging to access materials that are relevant and that are well done. It's one option to translate stuff into another language, and that's great if that's the only option, but what we'd really love to do is take that up a notch and really work with a committee to evaluate the materials to make sure that they really do have some cultural relevance and that we're able to disseminate those again across all of our various Marion and Polk County communities. And then we're also going to work on a video series development. We're really excited about this piece. We totally value evidence-based training and other training sessions. And we also recognize there's going to be a sector of our population that we're going to have a challenge meeting at an individual training. So something we want to use as a supplement, not a replacement, but definitely a supplement to some of those pieces is going to be some quick videos that we can throw into our social media presence. We can pop into supplement training sessions. We can share with our community partners. And we're working right now with our video team that's a local video company here in Polk County to make some of those videos. So the exact content we're still kind of working out, but we want it to really include the spectrum of mental health, wellness, and suicide prevention. So we're going to really lean on, again, sort of that committee space to decide what is this going to look like and how are we going to make this the most effective tool can, because again, we want it to be a sustainable tool that we can use many times and be really good stewards of those funds. So that's just a little bit of who we are and kind of what we have coming up. I know I kind of spoke quickly because I just didn't want to go over on my time, but I'm also open for questions, and I'm also happy to pop my info into if folks would like to chat offline as well.
You know, Abby, you come in here with such great energy and sharing all the work that's happening. And one of the things I'm wondering, what is the job title that you and Laura have? Because it's such a rare thing to have staff that are actually able to call it part of their job description, that they work with the coalitions.
Yes, absolutely. So I work in Polk County in our Family and Community Outreach Department. My title is technically the Community Training and Education Supervisor. I'm going to be super upfront. We made that up, and it really was our leadership that said, hey, we value this piece, so let's make a job description that makes sense with all the pieces that we want you to have. So I help coordinate our local service integration programs. I also get to work on the suicide prevention piece, and I work on parent education too. So a lot of that really requires weaving things together to make sure that programming is really effective in all of these sectors. So Kelly, her position, she's a health educator with Marion County. So she gets to support lots of different programs, but Marion County also has a suicide prevention coordinator who's on the call today too, I believe. Yeah. She's pretty new, just a couple weeks old now, I think it is. So lots of support. Yeah, Tammy is here, I believe. I know she got the invite, so I'm glad to have her. But yeah, so lots of support on both sides to really weave it in. And again, that came from just recognizing the need and then being really consistent with having staffing from both counties. So we have, again, just been really fortunate to have leadership that recognizes the value there.
The other thing is, I saw James mentioned it in the chat. That is a beautiful mission statement that you all developed. And I don't know if it would be hard to get back to the slide again, but just wanted to look at that for another second and see if folks, I'm just curious because I'm not remembering the exact words. I'm a little bit curious to unpack it and just hear like what that meant for you all.
Yeah, absolutely. Yeah, we've taken, again, it's been a couple of different iterations, and it's been a journey to kind of get there. And our steering committee played a big role in kind of helping identify some of these needs. And we did a SWOT analysis, which is typically used in sort of the business world, but we kind of retrofitted it to think about how does this work in our case and with what we're trying to do, what are our challenges and our obstacles, and what are our strengths and what are our opportunities. And so from there, we identified a couple of these things that kept rising to the top, and we sort of matched it together. And Dana Goodell was amazing at sort of wordsmithing and helping us put it together, as was Laura and Erin and Charlotte Lumby, a lot of our just powerhouses that we had around the table to kind of make this happen.
Great. Well, I think part of why it was resonating for me so much today is I feel like it's really what this webinar is about today. It's about thinking through how do we support people in making community connections and making it an approachable topic across the lifespan. It's just very good, accessible language. So that's great. Any other questions that folks have for Abby?
And I was also going to answer the part of your question about what my role is. So I facilitate our Zero Suicide Initiative at Marion County in the Health and Human Services Department. And my job description actually has written into it that I'm part of the collaboration and not necessarily the leadership, but just, some of the collaboration with the Mid-Valley Suicide Prevention Coalition. So they were very intentional about calling that out when they created my job description. It's just been a pleasure to be able to work with Abby and Kelly and now bring Tammy on board to do this work with us.
That's great.
Thanks, Laura.
I saw someone put in the chat that they were curious to know how we came up with our logo.
Oh yeah, good question. That's a great question. So we had an existing logo that totally served a purpose, and we kind of wanted to just have a little bit of a refresh and an update and be a little bit intentional. We worked with a graphic designer who is affiliated with our web development team, and we really talked about some of the, and this was not the first time we had tried to rework the logo. This was a couple of attempts in, and we really wanted something that was simple and hopeful, but stayed pretty simple. And we liked the idea of a sprout or something that was growing. We felt like that really encompassed sort of the connection and the collaboration around the table. And it's hard to see in this totally black and gray scale, but when you see it in the green, the inside of the leaves are kind of lighter and it gets a little bit darker as it goes out. And to me, that just sort of gives that, resonates with the hope and the growth and the opportunity that we see in our communities. And so it just really spoke to us. And again, we went through a number of different versions of something like this. And this one really just felt like it landed. It brought simplicity, but it also kind of carried that hopeful message and that connection that we hope to foster. So that's a little bit of our process, but lots of collaboration with our steering committee and back and forth with the poor graphic designer that probably didn't want to hear from us anymore. But yeah, it was definitely a little bit of a process.
Wonderful. Well, I think I will grab the microphone again back now and move us to talking about the Small Steps project. And as Jen pulls this up, this is very much something that we are hoping many of you will pick up and become involved with. It's really an appropriate kind of outreach program for any coalition or individual to do. And it's called Small Steps, Raising Awareness About Suicide Prevention in the Workplace. And next slide, please. So I'm going to just briefly, yeah, thanks. That's great. We don't really need to run through the agenda. The purpose of Small Steps is to help businesses and organizations learn about recognizing the warning signs for suicide, action steps for helping, reaching out, and knowing that help is available. And basically, this campaign emerged out of many discussions we had in the Alliance's Workforce Committee about the fact that we are supposed to be serving youth from age 10 through 24. And how do you reach all those 17 to 24-year-olds who are not in schools? They're working, they may be living at home, they may be living elsewhere, but they're not getting the kinds of information that folks get in school places. And we thought, well, one way to do that is really to reach out to employers who are likely to employ 18 to 24-year-olds. So we're going to focus on that set of employers today, but let me say this campaign is relevant for any age. It's not just targeted at 18 to 24-year-olds, but we thought we wanted to start there by reaching a lot of the young people who we know are not getting reached otherwise. Next slide. So why workplace outreach and awareness? Well, as the SPRC points out, people often spend a lot of their days at the workplace and they get to know each other. And as a result, they're in a good position to notice changes in behavior that could suggest risk for suicide or other mental health programs. And it's also the place where people have social connections. And how do we build on those social connections and link people up to the help they need when they need it? Next slide. So doing this work, we are partnering with the American Foundation for Suicide Prevention, which we're really excited about. And we hope that our other key partners will be you, each of you, and perhaps your coalitions and your communities of folks. So part of what we are bringing to employers is a packet, and it includes a new poster from OSHA that's been put out. That's a suicide prevention poster. And it starts with this: suicide is a leading cause of death among working age adults in the United States. It deeply impacts workers, families, and communities. Fortunately, like other workplace fatalities, suicides can be prevented. I think that also provides an entree for conversation with employers as you're talking with them about the idea of putting up information about suicide prevention, is that this is something that's impacting your workplace probably in one way or another, even if people aren't talking about it. And so providing resources and support, it can really save lives. Next slide. So we're hoping small steps will generate greater understanding about suicide, reduce stigma, and help people know where and how to ask for help in a crisis. Next slide. So what we are asking is for people to take a package to employers and ask them to become part of our Small Steps program. And there's included as a one-page description. There is a guide for employers about how to talk with employees and give some basic information about suicide prevention. There's some basic facts. There's information sheets in there about Alliance and AFSP. But I would say most importantly, there are materials for posting, which include the OSHA poster. I mean, even if we got the OSHA poster that describes the five actions to help someone up in bathrooms across our state, it would be huge progress. It also links people to the 988 number at that point. So the pitch to make to employers is that in the same way that you have OSHA material up in your break room, you need to have material up about mental health and how to support your employees' mental health. And starting here is a packet and a bunch of resource materials we can give you to do that. And please go forth and do that, and you'll be enrolled in our program, and we'll be able to say that you are a suicide safer workplace. Next slide. So I want to just share a little bit of what's on the OSHA poster. It includes these five kind of actions you can take, and there's a little more detail next to each of the actions, but it's very accessible. Any grade level should be able to read it, and it's practical, and again drives people to the 988 number. Next slide. Our hope is that we're going to reach 50 businesses and community organizations between now and December. And I think that's very manageable kind of goal, especially if any of you decide, yes, we'll take this on. And September, Suicide Prevention Month, is a great time to go out and talk to employers about suicide prevention and ask them if they're willing to be part of saving lives and sharing information with others about how they can get help when they need it. Next slide. So what would we like you to do? We'd like you to reach out to businesses and community organizations, engage them as partners in suicide prevention by explaining the process. We'd like you to review materials with employers, answer questions, and talk with them about ways they can share information with their employees, share ideas and opportunities about how to join local efforts. You know, this is real opportunity if you are working with a local coalition to connect them up with your coalition, and also share information about AFSP and AFSP's workplace training, which we'll be hearing a little bit from Erin about. Check back to see how it's going once they've put the materials up, and see if more materials are needed. And finally, we have a contact sheet that we ask that you send back in to let us know that you had enrolled businesses in this. So we have these as physical packets of materials together. I think I saw, Laura, you asking if we have it in multiple languages, which is a really appropriate question. And the answer right now is no, but that sounds like a next project for us to get moving on. So I'll pause here and see if folks have questions.
Another question I had was that if a business decides to take this on and then wants to say promote it on like their social media or something, say like, hey, we're a suicide safer business, is there any sort of like digital resource that they could use to promote that, that also keeps the messaging and branding in line.
Another great idea, Laura. This is why we need to do work in coalition with one another and work together, because I think that doesn't seem to me like that would be hard for us to put together. And I think that would be a really good addition.
Awesome, thanks.
Let me just pause here. And the other thing I want to ask is, so as you're hearing this information, can you share in the chat, what are some places you would think about going to ask to do this? Like, just what kind of businesses might be appropriate to ask to do this? Think particularly about where you've seen 18 to 24-year-olds working. Sure, LGBT spaces. Coffee shops, grocery stores, fast food, movie theaters, gyms, tattoos. Great ideas. Great ideas. Gas stations, convenience marts, all are places that could be part of suicide prevention. Bathroom stalls, I think, yeah, that's a great idea. Businesses near college campuses. Oh, DoorDash, that's an interesting idea. Parks and community sports fields. So and this is one where I actually would love if people wouldn't mind turning on their mics and answering back. I actually am somebody who has a bit of a clutch, like when I think about having to go to a business owner and ask them to do something. How would you approach a business owner with this ask? Any of you have suggestions about how you would go in and do that? Gordon,
James
who I
is
know is
next.
done. Oh, and I saw James. Okay, James, and then I'll catch you, Gordon.
Yeah, I put LGBTQ spaces mostly because of, I used to throw the red dress party and we had to go around and ask for sponsorship quite a bit. I know that throughout the pandemic, we've seen quite a few members of the LGBTQ community dying by suicide throughout the pandemic and beyond. And a lot of those, not only are they working at these places like LGBTQ bars, community centers, things like that, but they're also members and actually customers, so that it's a larger community of folks to reach out to. Personally, it's building a personal relationship is usually the best way. I've been to a lot of these spaces, so I'm comfortable talking about my work there. But building that trust is probably the biggest ask. I know, like, talking about suicide can be really tough, as opposed to talking about wellness. Hey, this is about, mental wellness for this community, and thinking about some of the, connecting with them in ways that might be, some folks have been affected by suicide and they have had a personal relationship with it. So I think it's just a matter of building those relationships with the business owners.
That's great, James. I was actually thinking about, once we will have the packets available next week, I was going to go down to my local convenience store where they see me way too often and talk to them about it. And Gordon, you've had a huge amount of success reaching out to businesses. You want to add a thought?
Yes, here? And I put in the chat zeroattempts.org/partners.html. And there's a listing of probably close to 220 locations where we currently have our Are You OK brochure and our crisis cards. And what I've, starting in January, after the pandemic, we were down to 104. And right now we're at 200 and something, 23 or so. I just walk in, and I've added in the last 2 weeks the barbershops and the salons, and they are easy if you've got something to hand them for our material for their clientele. But I utilize that Are You OK brochure to say, learning your employees, learning the risk factors and all, because they've already got the setup with their clients to have that personal contact. And I very seldom get turned down. I've gotten in bars. We've gone after all the bars for our coaster campaign, which will be distributed on the 30th and 31st, and dispensaries and all kinds of places. But just walk in, if you've got the material, walk in and ask for the manager. Now, often they will say, well, our manager's not here, or it's a corporate office, or like Dutch Brothers, it's a franchise. And I just give them my card. I give them the material and the card, and then call back in a week or two. That's the way. And I've used, over the last 4 years, I've used the RUOK workforce campaign that they developed, and I just use that and go into all the places when I want to add a new location to our listing.
It's really terrific. I've got to say that Gordon, partially you, and then also Scott, when Scott was working in Marion County, I'm sure Laura will carry on the great work of, I actually went and got a coffee where we had one of the suicide prevention coasters on it, and I was so inspired by that was part of what helped us to think about doing this. The other piece we are adding into this, along with the materials, is linking it explicitly with, if anybody gets interested in more than just saying, yes, we'll post materials, is bringing the Talk Saves Lives to their workplace. And Erin, I know I'm putting you on the spot, but do you want to say a couple words about what Talk Saves Lives is?
Yeah, absolutely. Hi, everybody. For those of you who don't know me, my name's Erin. I'm the Oregon Area Director for the American Foundation for Suicide Prevention, and you're about to hear from me more. But our Talk Saves Lives program is our introductory program about suicide prevention and awareness. It's all centered around the idea that talking about suicide can help save lives and bring hope. And we have a module specifically for the workplace. So it's a 1 hour long presentation that covers some basics about, facts about suicide, what we know can be a contributing factor, and what you can do to help prevent suicide. And then it talks a little bit specifically about what that looks like in the context of a workplace. So one of the follow-ups that we're hoping might work through this program as well is, if you do have folks that are really engaged, they say, oh my goodness, this is great, I want to put these posters up, what more can we do? A great next step would be to schedule one of those Talk Saves Lives presentations for them to do with their employees. It's something that AFSP can come and present. It's also something that we can train others to present. We have been trying to kind of pitch out to businesses and haven't gotten a lot of bites. So I think that the Small Steps program could just be a way to offer a natural extension to what businesses are doing if they're interested in doing so. And it's a 1 hour long presentation. It can be done in person or virtually.
So Erin, if people want that, would they contact you?
Yes.
Yes. Okay. So I did put I'm glad that's true, since I did put your email contact at the end of the slideshow.
Yeah. And we also, there's a link on our website to directly request programming as well.
Great. Great. Thank you. Okay. Next slide. This is the contact sheet that we will send out with the packets. And this would just be a way for us to track some of what businesses around the state are doing this work. And I think that we will keep a ticker going on our website as well about how many businesses have engaged. And I'd like to cheat by including all of Gordon's businesses, because basically, even though Gordon's using a different packet of materials, it's very much the same aligned mission. And it's more than anything, that's what's important to us, is getting the word out to people about how they can access the right help at the right time, and destigmatizing the conversation around mental health and suicide. Next slide. So this is here are some kind of talking points and ideas for how to I'm sorry, being a little inarticulate here. Here's actions we'd like employers to take. Share information about small steps and suicide prevention in the workplace, and display posters, spread the word, share about it with other folks, and then, you know, ideally they'll become allies, champions themselves, and maybe they'll even get involved with their local coalition. James, I see you're jumping off. I want to be sure that folks know that they can order packets if you would like to have a small steps packet that has all the materials in it from Jen Frega. And there's an order form that she just put in the chat. So you can fill out that order form, and we'll be sending that out to our listserv as well. Next slide. So I think I've already covered this. Really, we're looking at that. So here's where the steps are. Packets to coalitions or advocates starting really next week. We'll start mailing them out to you. Please return contact sheets to Jen. Once you've done them, you can either mail them to her or give her a call and just give her the information. We're going to keep a running tally on the website. And if any of you need help, you can contact me. I'm happy to help you with doing this. And I also think that there's a number of people around this webinar today who would be very good at doing this as well. I'm just curious, by a show of hands, do any of you here think you're going to take this, anticipate using something like this small steps program? Will you see, this is where I have to practice my pitch. Will you join us? Will you join us in taking a small step to save lives? Will you order the packet and share it out in your community? Montel, you're saying yes. Anyone else? Erin? Yes, Laura. That's great. Erin, you already have 22 businesses that are sponsoring you, right? AFSP?
Yes, I was like, it kind of, I'm raising my hand like you don't know that I'm already committed, but I am. Yeah, our plan is to share this out with our walk sponsors who are sponsoring walks throughout the state this year.
Think about also your friends. Like, do you have any friends who are small business owners who own a restaurant or a convenience store? It's just really, let's use our networks of support to get this information out there. Next slide. And so for more information, contact Jen or Erin. And if any of you have feedback for me, I would love it. This is the first time I've talked about this. I felt less smooth than I wanted to be. And so if you have ideas about how to promote this, package it, talk about it more clearly, I'm very open to that. But I'm super excited about us having this really concrete way. And I think we could get this to many more than 50 stores across the state and begin to reach out to the broader population. So with that, I want to say that this really connects in with the work of AFSP that they do with their walks. And I have asked Erin to come talk with us about the Out of Darkness walk. And I'm just so thrilled to introduce Erin to you. And just to preview, we will, after Erin speaks, Diane Kaufman, who is here, has written a beautiful, beautiful song. And it was in honor of Sinead Connor, and she's had it professionally produced. And we'd like to, after Erin speaks and we've talked, we'd like to, at the end, play that song for you. And it's very moving, and it can be very intense for people, but it's also very, very hope-filling. So I'll preview that, so just to have people stay on till the end with us, and I will welcome Erin Weldon to talk about the Out of Darkness walks and how you can get connected with AFSP.
Lovely. Thank you so much, Annette. About how much time do I have?
You have 20 minutes.
Okay. Perfect. All right. I'm just working out with Jen here to do the screen sharing part of it. And I am going to turn off my camera while I'm sharing my screen because my my hashtag nonprofit laptop sometimes gets overwhelmed. So give us just a sec here for tech. All right, can everyone see my blue screen?
Yes.
Yes, perfect. Wonderful. Well, like Annette said, my name's Erin. I'm the Oregon Area Director for the American Foundation for Suicide Prevention. I'm based out of Salem, but I oversee the work of our volunteers all across the state. And I've been with the organization for a little over a year now. So some days it feels like I've been in this field for a while, and some days it feels brand new. So I'm going to start out by giving you all just a quick overview about what AFSP does for those who aren't familiar, and then I'll go into talking about our Oregon Out of the Darkness walks that are coming up this fall. Oops. So AFSP's mission is to save lives and to bring hope to those affected by suicide. When we think about those affected by suicide, that includes lost survivors, it includes those who struggle, and it includes those who support them, whether those are friends or family, or whether those are folks working in the field of suicide prevention. The organization was founded, let's see, about 35 years ago. And it was kind of a unique founding story. As a lot of you probably know, suicide prevention research wasn't something that happened until fairly recently. There was sort of an idea for a while that death by suicide just happened. It was sort of thought of as a moral issue and not a health issue. And luckily, we've really had a shift in the last several decades about that. And the way that AFSP started was lost survivors got together with researchers and said, hey, we really want to know answers, scientific health-based answers to why suicide happens, what we can do to help prevent it, how we can take action. So the families said, we'll do fundraising if you do the research, and originally started as a research organization. AFSP now, we combine that science and grassroots efforts all across the country. And we are the largest private funder of suicide prevention research as well. We do about 30 million in grants every year to really help us come up to answer that question of what we can do to help save lives. So we have 4 core strategies. We've got that research that I talked about. The next thing we do is turning that research into education. So distilling it into programs like the Talk Saves Lives program that I brought up earlier, so that we can share that out in the community and educate folks about mental health and suicide prevention. We advocate for public policies and mental health and suicide prevention. So this picture here is from our state Capitol Day that we had in Oregon this February. So advocating for things like funding for 988 or availability of training for folks working in healthcare. And finally, supporting survivors of suicide loss and those affected by suicide. We have a little bit of a unique model. So AFSP is a voluntary organization, which means the majority of our work, the majority of our strategy is driven by our volunteers. So we're led by a 9-member board of directors. I think Angela Perry, who's our board chair, is on this call right now. So that 9-member board of directors oversees what we do in Oregon. And then there's one staff support person, which is me and my dog that you can see in my profile picture. So our goal really is to empower community members to stop suicide in their communities through volunteering with AFSP. The model isn't that I go out there and I present all of these things. It's that we train volunteers who are already embedded within communities to present programs, to do outreach, to host events. Our core program is Talk Saves Lives. We really believe that talking about suicide can help prevent suicide. And anyone can talk about suicide. You don't have to be a behavioral health expert to have a conversation with someone who you're worried about. So I work here in Oregon. We do outreach. This is a picture of us tabling at Hillsborough Pride. If anyone's going to be at Salem Pride this weekend, we will be there. We have free resources and programming. Visit our website, afsp.org/Oregon. There's links there to request free print resources for prevention and postvention, as well as programming. Advocacy, I think you're going to get a copy of this presentation as well, because I realize I'm throwing a lot of links at you. If you're interested in being a field advocate, you can sign up online. A lot of that is done online via email. And then, like I said, we gather once a year for a state Capitol Day. Our Out of the Darkness walks, which I'm going to talk about a lot more momentarily. And then we also host Survivor Day events. The Saturday before Thanksgiving is International Survivors of Suicide Loss Day. And AFSP has an event model to bring together lost survivors on that day for a day of remembrance and healing. And it's a model that's designed to be kind of replicated and customized, throughout communities. So we'll be releasing the dates soon. We know we're going to have one in Portland, in Coos Bay, and in Bend. And we have a couple other sites in the works as well. Again, our website has all that info. A few things that AFSP is not. I know with a lot of us that work in this field, it can be confusing to figure out who does what. We're not a crisis center or crisis line. So if someone reaches out to us in crisis, we are going to redirect them to 988 or to local resources. We don't run our own support groups, and our chapters are not support groups. Again, if someone reaches out, we're going to redirect them to something like Suicide Bereavement Services Northwest to find a support group in their area. And we don't make grants to other organizations. We do make those research grants to funders, but we aren't able to fund other local organizations. All right, this is what you came here to hear about. So our Out of the Darkness walks are our signature events. They bring together friends, family, and supporters to raise awareness, as well as to raise funding for suicide prevention programs and research. We have our community walks, which I'm going to talk about shortly. We also have campus walks, which take place on college and high school campuses. I just met with Oregon State University right before this call to lock down their date for this spring. We have an overnight walk every year that Angela, who's on this call, has participated in before. It is a walk from dusk until dawn. It's about 17 to 20 miles. And then one other Out of the Darkness walk that we have here in Oregon is we have correctional facility walks. So a correctional facility, Santiam Correctional Institution, approached us in 2017 and asked about replicating the Out of the Darkness walks within correctional facilities. And we said, if you plan it, we'll come. And now we have, I think, 5 scheduled for this season. It's really unique. There's no place other than Oregon that's really bringing these walks within the walls of correctional facilities. So we're proud of that one.
That's incredible, Erin.
Thank you. So I'm going to show you a quick video about the walks and then talk a little bit more about what's happening here in Oregon. And we'll all cross our fingers that this works. So Annette, if you can't hear the sound, please let me know.
I will tell you.
I'm walking for my brother.
I'm walking for my mom.
I'm walking for myself. If suicide has touched your life in any way, please join us for an Out of the Darkness community walk.
These walks are so important to me because it provides a lot of community and hope. Suicide is a tough thing to talk about. Having community makes it a lot easier to talk about. Talking saves lives.
When I found AFSP and I found people who had been through similar experiences, I found a place where I could speak openly, people that understood.
The community is so important because I don't think that I can do it by myself. It's so much bigger than me.
I just feel connection, a sense of community, a whole lot of love. It just radiates love. I think everyone should come to an Out of the Darkness walk.
Walk with us.
Join us.
There is hope.
The world is a better place with you in it.
Register today at afsp.org/walk.
I love that video. It says a lot better than what I could say to you here about the importance of our walks, a lot about connection and community. So coming up in September and October, we have 8 Out of the Darkness walks happening throughout Oregon. The schedule is here. Also on our website, afsp.org/Oregon walks. You can see a list of all the walks. Angela and I will be on the road for about 6 weeks. So we'll be in Bend, Scappoose, Medford, Coos Bay, Eugene, Pendleton, Portland, and Salem. It is kind of a quick road trip for us to build community throughout the state. And I really encourage you, if you can, to come to one walk or several walks. I'm going to talk a little bit more sort of about the model and how you can get involved. So the idea of our walks, they're called community walks for a reason. They are by the community for the community. Each walk is led by a local chair who's a volunteer. So these are not, even though I'm a staff member, these are not mine. I'm not in charge of them. We want somebody within the community to be leading what that event looks like. They're designed to create a time and space for anyone affected by suicide to come together, to find that connection, find community, share stories, share memories, and also connect with resources. And because each walk is led locally, each walk is different. All of our walks include community partners who share resources, memorial activities, an honor ceremony, and the walk itself. Beyond that, a lot of walks add in their own extra flair. Some have interactive activities, some have live music. Again, it's really kind of tailored by the walk chair. And there are a lot of ways to get involved. Because these are by the community for the community, you are the community. So I really want to encourage you, if possible, to find a way to get involved and also to use these walks as a space for you and for your community. So the simplest one, walk with us. Find your closest walk online at afsp.org/Oregon walks and register. There is no cost to participate. You will be asked if you want to set up a fundraiser when you register, but there's no fundraising expectation. We want everyone to know that they are invited and welcome to come to the walks. There is a way that you can start a team as well. A lot of people use the walks as a way to build community, whether it's with their friends and family, whether it's within their business. So you can create a team or you can join a team. There are also teams that are open to having people from the public join. And then if you do live in a town where there's not a walk, right? Because we recognize that, well, we wish we could have an event in every county and every city and every town. We can't quite drive that many places. So we really encourage folks, if there's not a walk in your town, to create a local team for whatever walk is closest. You can name it after your town or your area if you'd like, and then travel together on walk day. Bring your community together and come visit us at one of the other walks so that you can have sort of that the walk experience as well. Another way to get involved, help us connect with your community. Like I said, we have community partner booths at the walks. If you can think of an organization that works within mental health or touches suicide prevention in any way, and as we know, that's a lot of sectors of the good work that people do. We would love to see one of those partners at our walk. So either if you work for one of them, sign up for a booth. If not, reach out, say, hey, I heard about this walk that's coming up. I think that it might be a great way for you to reach out to folks who you could help. There's a way to sign up on the website. Each local walk website has its way to sign up. Similarly, if you, we just talked about the Small Steps program. If you know a business that's passionate about mental health, that's looking for a way to sort of show that to their community or to their staff, invite them to either create a team or sponsor and get involved as well. And finally, Another way to get involved is to lend a hand. First up is to help promote the walk in your community. So last year was my first Out of the Darkness walk season. It was incredible. It was life-changing for me. One of the things that I unfortunately heard a lot from people was, I wish I'd known about this sooner. I just found out last night. I would have made a team. I would have invited a friend. We want anyone who could use this space, who could find connection in the space, to know that they're invited. Word of mouth is the way that a lot of people find out about the walks. My friend told me about it. Social media, we have information on our Facebook and Instagram that you can repost. And then also, if you're interested in getting out on the street a little bit, we do have flyers that we can send you, or send you digital copies of. Again, if you know somebody who you think that this event could be helpful for, help us to make sure they're invited. We also always need day of volunteers. If you love putting up tents, organizing chairs, if you love talking to people, if you love connecting with people, we can use you at a walk. There is information, again, on each local walk page about how to sign up to volunteer. And we have a variety of roles. So if you like to do that physical work and get your workout in, we can do that. If you want to be at a memorial activity and be there to connect with people, we can use you there as well. And then finally, like I said, these walks are our biggest fundraising stream for AFSP. They fund the work that we do throughout the year. They also fund all of that research. So we invite folks, if they're able, to donate or to fundraise. One of my favorite things that folks do is host their own fundraising events that kind of become their own little community events. So in Coos Bay, for example, they do a rubber duck race every year, where you buy in to get a rubber ducky for $5, and then they dump them in the water in a creek, and whoever crosses the finish line first gets a prize. So it's a fun way to fundraise, but it's also a day for all of them to come together and to have fun and build some community. Where to find info? Like I said, you'll be getting this, and I can pop it in the chat too. Easiest place to go is afsp.org/Oregon walks for a listing of all of these walks. And then also, once I'm finished, I'll pop those links into the chat. And then if you're also interested in getting involved with AFSP in other ways, afsp.org/Oregon is our main website. Oregon@afsp.org is our the best email address. It can get both me and Angela and other volunteers, or follow us on social media. We would love to see you at a walk. And if you're not able to attend a walk, we would love to work with you in a different way. Again, on our website, there's volunteer information, there's event listings, and there's also places to request resources and programming. All right, that is what I have. I think I'm just under that 20 minutes.
You did great, Erin. And Erin, if someone wanted to promote their own coalition or talk about that at an Out of Darkness walk, would that be appropriate or inappropriate?
That would be appropriate. I'd ask that they get in touch with me. My camera's being finicky. Just to talk about what that looks like, because a lot of different coalitions do different things. But I think that Abby and the Mid-Valley Suicide Prevention Coalition are going to be at the Salem Walk and putting together some activities. The Jackson County Suicide Prevention Coalition is actually sponsoring the Southern Oregon Walk. But it is a great place to promote the work you're doing. If you have trainings coming up, if you have gatherings coming up that you want folks to know about, this is going to be the place where the community, your community is there. So yes.
Well, and I just have to say, I've appreciated the incredibly collaborative kind of viewpoint that you take. And I think that I'm really hopeful that in the suicide prevention world, we can manage to support each other. All of us support each other's organizations rather than do the kind of infighting that seems to happen so much in social change, social service agencies. And so thank you for being that kind of partner.
Yeah, of course. That is what we want to foster.
So I'll pause to see if there's any other questions. Well, I really want to thank you all for staying on and listening. And I'm going to ask Diane now to introduce the song that she's going to share. And I just want to say that we will leave the Zoom on for a while afterwards if people need to talk or process afterwards. But I know that I started my week last week hearing this song, and it really fed me in a lot of ways. So I hope it